Hi, this is Dr. Coons again, and I want to cover the topic of what is a disc surgery and what does it entail. When all else is not working and they've exhausted hopefully all of the options and not just jumped right to the conclusion of doing a disc surgery. The disc surgery might be three different methods. The first method might be considered what's called the discectomy, where they're going to go in and they're going to remove a piece of the disc. They're maybe going to remove a piece of the bone called the laminectomy, and they're going to try and artificially make the hole bigger where the nerve root comes out. That's by far the most common surgery of the past. It started to be a little bit less the primary surgery, and now we kind of do a lot more fusions, because the fusion makes it so that hopefully there'll be less instability once you take bone and disc out of that area. So they go in and they put a bone pack, what's called a cage, where they screw some metal plates to the spine, and then they hope that that will heal back without a lot of scar tissue causing pressure on the surrounding nerve structure. The third and a little bit less common type of surgery is maybe an artificial disc. There have been some big advancements. 20 years ago, if you would ask us about artificial discs, we would have said no way, because they just don't have durability. If somebody's 45 years old and they need an artificial disc, you don't want to have to do another one in 20 years. In fact, at that time, it was just impossible. What happens if there's more than one area that needs the surgery? What if it's 3 segments? We just simply don't do that in the United States. 1 segment only, and in Europe maybe 2. But over time, the artificial discs got better. The materials they were using got better. The complexity actually got a little bit simpler. So now the artificial discs are definitely an option for patients. But again, I would say that is not the norm. It should be the thing that would happen only if there's nothing else to occur, and that's the only other option you have left. So definitely out there, if you're out there and you're wondering, what about me? What's happening with me? Definitely come on into the office. Let us talk with you and find out if there's something we can do for you on the conservative end of things, and then walk up the list for you and talk to you about when those things would be appropriate. If you were to talk to a spinal surgeon, for an example, today, he would tell you the same thing. Don't do surgery first. It's a last option. Do conservative care, chiropractic care, massage care, exercise therapy, decompression therapy. These are all things that you want to do first before you jump to the final conclusion of disc therapy. Thank you. Talk to you later. Bye-bye.